You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us.
Hello, and welcome to another episode of In the Ladies' Room with Dr. Donica. Now, for decades, I have said that when I become a world fashion trendsetter, women will be wearing sneakers most of the time. While I haven't yet become a fashion maven, and may never, I have walked the talk. I wore white tree-torn tennis sneakers under my gorgeous full wedding gown in 1988, and danced to my comfy feet's content at my children's B'nai Mitzvah with sparkly rhinestone-studded Skechers under my gown 20 years later. But despite my efforts, more and more women are clinging to higher and higher heels, often at great risk to their leg and foot health. Ironically, women seem to care more about how their legs and feet look rather than how they feel or how healthy they are. And even more ironically, in the discussion of the cost of healthcare, foot problems and knee problems and hip problems and ankle problems are a glaringly obvious example of how a little prevention goes a long way. Now, not only are sneakers more comfortable than heels, they're safer and healthier. Today, we're going to talk with Dr. Nancy Yen Shipley, a board-certified orthopedic surgeon, about the hazards of heels. She's fellowship trained in sports medicine and arthroscopy of the shoulder and knee. She's also a team physician for the U.S. ski and snowboard team. She's one of only 6.5% of orthopedic surgeons in the United States who are women. So we welcome her to the ladies' room. Dr. Yen Shipley is passionate about caring for her patients as well as blogging about her path to a medical career, as well as bone and joint issues. As a mother and as a surgeon, she's a mentor and champion for women in diverse surgical specialties and brings awareness to this through speaking engagements and an active online presence. In her free time, Dr. Yen Shipley enjoys spending time with her family, snowboarding, stand-up paddleboarding, playing tennis, and enjoying the great outdoors and the great food in her adopted hometown of Portland, Oregon. And she spends time on Twitter, where we met. And I have to share with you that last week in the Barbie Challenge, which was kind of fun, Dr. Yen Shipley was arthroscopy Barbie. So please help me welcome arthroscopy Barbie. You are in the ladies' room. How did you come up with that handle?
You know, I wanted something that represented me as a surgeon, and with the types of surgeries that I'm really passionate about and have subspecialty training in, I thought arthroscopy Barbie would be a good handle.
And so tell our listeners, we actually have listeners who are not on Twitter, believe it or not. What was the Barbie Challenge and how did that start?
So there is a surgery resident on Twitter, and her handle is OR Barbie. And I think it's a great title because it pokes a little bit of fun at the idea of Barbie, but at the same time, it plays up the irony of what Barbie, I guess, traditionally stands for, with her pink car and all of that, and juxtaposing that with the idea of a woman in surgery, and how uncommon it is to have a woman in surgery. And so the challenge came up after she was cyberbullied.
By another woman.
By another woman, a nurse, actually. And she made it public, the kind of message that she received, and it was really kind of cruel.
Yeah, and she was bullied for, ironically, she was being accused of being anti-feminist because she was affiliating her name with being a Barbie and a surgeon. And let me remind everybody, in defense of Barbie, that Barbie has had over 200 careers, including being a surgeon and a physician and a baby doctor and a veterinarian and a dentist and an astronaut and many, many more careers. So Barbie has proven to girls throughout, since 1959 when she was launched, that yes, you can be a feminist and feminine. And I think that was what the overwhelming response was, is that we shouldn't be judged on our appearance. Now, segue with that and your career. How many people a day say to you, you don't look like an orthopedic surgeon?
You know, I think now that I've been at my practice and at my hospital for several years, a little less so, but I still get some from the newer patients that I meet. It used to happen a lot more, but I think less and less so now that I've been in one spot for a while. I think one of the more heartwarming things that I get are from the little ladies, the ones that are like 90. They've seen a lot of change over time, and they just are tickled to see a female surgeon and really happy to have their physician be female.
Yeah, and it's pretty remarkable that in 2019, only 6.5% of orthopedic surgeons are women. So we still have a long way to go there. Of course, you're the second orthopedic surgeon woman who's been in the ladies' room. The last time we talked about with Dr. Alexis Colvin about the big O, osteoarthritis. So I'm sure you see a lot of osteoarthritis in terms of arthroscopy, but please tell our listeners, what is arthroscopy?
So arthroscopy or arthroscopic surgery is a minimally invasive surgery in which we make very, very small incisions. They're probably about 1 centimeter, which is about the width of your pinky nail. And we're able to perform pretty significant procedures through these small incisions.
Okay, so who needs an arthroscopy?
It depends. So as a surgeon, people are always surprised to hear that I always try conservative management first. And if the individual fails conservative management, then I'll pursue something surgical.
Okay, so tell me what conservative management means.
Right, so non-surgical treatment. So we may include physical therapy, medications, etc., modification of activity. And if an individual doesn't get back to the level of function that they hope to be at with that, then we offer surgical solutions. Now, to get back to your original question, arthroscopic surgery is done through these smaller incisions, but we can do surgeries within the knee joint, within the shoulder joint. There are also hip arthroscopies, which I don't do, but you can really put a scope in just about any medium to large joint.
Got it. And sometimes you do them for diagnostic purposes, and sometimes you do them for treatment purposes. So describe a typical patient who might need an arthroscopic procedure for diagnostic purposes.
Sometimes if the physical examination, along with the history, and along with studies like x-rays, MRIs, CTs, just don't give us a solid answer, but we've really exhausted all of our options. And between myself and the radiologist that I may rely on for their opinion on the read for the MRI, we're not getting any answers, then in those situations, an arthroscopic diagnostic arthroscopy may be warranted.
What are the kinds of things that you can find on a diagnostic arthroscopy that you don't see on MRI?
Well, let's talk about the knee, for example. An individual may have sensations of slipping or their knee being unstable, and the MRI may be negative. Their examination may not normal. Yes, thank you. So their MRI may be normal. We really don't see a reason for what's causing their symptoms. Perhaps my examination of the person is fairly normal, but yet they're still having these complaints. Sometimes when you exhaust all of your non-surgical options, then we may end up doing an arthroscopic surgery for diagnostic purposes.
And what could you find that you wouldn't have seen on the MRI? You know, sometimes we feel like an MRI is supposed to be magic. You know, it shows us and tells us everything, but it doesn't.
So one example within the knee in which we may find an injury that isn't represented well on the MRI, and this is just one example, is an ACL or an anterior cruciate ligament tear. Now, a lot of times the MRIs actually kind of look normal. And oftentimes we will pick up the injury on the physical examination and together with their history. So if this person had like a basketball or a soccer injury where they felt their knee pop, it got really swollen, and after that it was unstable, then a lot of times we put two and two together, and we're not going in there with a pure diagnostic arthroscopy in mind. But even in those situations with the MRI being negative, I always start with a diagnostic arthroscopy. That's the first thing I do when I'm in there. Even if the MRI does show something, I go through that same procedure every single time, and I look at the different parts of the knee very systematically and look for either the pathology that we're expecting to find, meaning like the problem that we're expecting to find, or to find something that maybe just didn't show up on the MRI. And then at that moment, we make a decision as to whether I need to do something more about it.
Great. All right, now let's get to high heels, which are my favorite pet peeve. I struggled through probably the first 25 years of my life in heels. And then sometime in the mid to late 1980s, it seems like women in big cities across the country got the idea simultaneously that we could wear sneakers to work or to a party and then change into our heels. Now I'm at the point in my life where I just don't care at all, and I never wear heels at all. But tell us some of the common injuries that you would see as an orthopedist from the hazards of heels, which is what I'm calling this segment.
So in the short term, if you have ill-fitting shoes, then certainly, of course, we all know about blisters, but you can get calluses or corns that are a little bit harder to take care of. And so those are kind of like calluses plus. And over the longer term, you can actually have changes in the structure of your foot and your toes. You can end up with.
Probably should take it back even a step further about you mentioned ill-fitting shoes. Those don't have to be heels. Any kind of poorly fitting shoes, including flats, can have those effects. And I think probably the number one mistake that women make in terms of having poorly fitting shoes is we all assume we're the same size as we were when we were in high school. And that's probably not true for the rest of our bodies, and especially those of us who've had children. Talk about how the foot changes with aging and pregnancy.
Well, a lot of women in pregnancy will experience changes in their shoe size. During pregnancy, your feet can swell, and so this could be a temporary change. And there are many women who, after pregnancy, have a permanent change in size in their feet. And so they run into trouble when they keep trying to squeeze into the same shoes. But you have a good point in that it's not always high heels that cause the problem. Remember those pointy flats that were really fashionable? Those are terrible.
So when we're talking about pointy shoes, we're talking about the toe box.
That's right.
So talk about the effect of a narrow toe box on nerve compression and blood flow and even deformities of the toes.
Right, and so you can have some nerve irritation, nerve compression, if your toe box is too narrow. And you can also develop toe and foot deformities. One example that can develop over time if your toes are really getting squeezed in there is hammer toes. And so it really is exactly what the name is. The toe kind of starts looking like a hammer. And it's very close cousin, the mallet toe. They're just different names for toe deformities that can develop. And sometimes these deformities can become so problematic that it will be troublesome to squeeze into any kind of shoe. And sometimes they do require surgery.
All right. And one of the questions I get a lot from people regarding those kinds of toe abnormalities and bunions is, who do you see? Do you see a podiatrist, a foot surgeon, or do you see an orthopedist, or how do you know?
Well, there's different kinds of training. The orthopedic surgeon goes through 4 years of medical school, followed by an orthopedic surgery residency, which is 5 years. And following that, there's another year of subspecialty training in complex foot and ankle issues. And I probably can't speak 100% to the exact training of podiatry, but I do know that podiatry school is generally 4 years, and this is after your college education. And I also understand that some podiatrists will do fellowships as well. And so while there is a little bit of overlap on certain conditions, the orthopedic surgeons do have a little bit more comprehensive training. It's definitely more time to complete an orthopedic surgery fellowship and residency. And so, for example, I have a partner who has done foot and ankle subspecialty training, and so I'll often defer the complex foot issues and ankle issues that I'll come across to her. I'm a general orthopedist and an arthroscopy trained orthopedic surgeon, and so while I do take care of the feet and the ankles, sometimes if it's a little bit more complicated, I'll call on my colleagues.
Okay, so next, bunions. What are bunions and what do you do about them?
So bunions are deformities involving the base of the big toe and where your big toe connects the metatarsal, which is the long foot bone in the I guess we call it the forefoot in orthopedics, but for the average person, they might actually think of this as kind of the mid part of their foot. And so bunions can deform when there are either bony deformities and or oftentimes in combination with ligamentous imbalances or even tendinous imbalances in which you get a deformity at that joint at the base of the toe. So you can get some pretty significant shoe wear issues with that and also pain when the bunion gets severe enough.
So I tried to look up what the most common hazards of heels were. And believe it or not, there's no data about what the most common injuries are. In my experience, I assume that most of the injuries of high heels are from falls. So I would assume strains, sprains, tears. Is that true, not true? What's your experience?
Well, I can't put any numbers to it either, but I will say from experience, I definitely treat individuals who have had haphazard events with their shoes, tripping, having their heel caught in a grate, etc. So you definitely can get injuries of the other parts of the body from falling due to poorly fitting shoes or pointy shoes or high-heeled shoes.
So what's the worst thing that ever happened to you as a result of wearing high heels?
Oh, goodness. So, you know, I actually haven't had any bad high heel injuries, but a different kind of shoe, a shoe that actually as medical professionals we wear often. I have fallen out of Dansko clogs.
I was going to say, please don't tell me it was Crocs.
Not Crocs. No, Dansko shoes are great for standing still. They have that wide toe box. For me personally, the molded bed actually works really well, especially when I'm standing statically for a long period of time. You'll see surgeons wear this. Physicians in general tend to favor these. People who work in kitchens tend to wear Danskos, but if you ever look at a Dansko, you can see that the heel is very built up. So there's not a lot of lateral support. And the way that they're supposed to fit, they're supposed to be nice and loose in the heel. And I have tipped over sideways and sprained my ankle in those.
So the worst high heel injury I ever had was actually disco dancing in early 1980 or 81. And another woman I was wearing high heel strappy sandals, but another woman who was wearing very spiky heels stepped on my big toe and actually broke my toe from using her high heel as a spear. But I've also gotten my heels caught in sidewalk cracks and grates and fallen and things like that, contributing to knee injuries. So of course, when we're talking about any kind of footwear problems or hazards of heels, we have to remember that whole thing about the knee bone being connected to the hip bone, etc. So
true.
once we get past the foot and then the ankle, we didn't talk about Achilles tendon shortening. You want to talk about that a little bit?
Certainly, if an individual is constantly wearing high heels, it just...
Like Barbie.
Like Barbie. Although not in the OR. I'm pretty sure OR Barbie's wearing some good supportive shoes. But yes, if you're in high heels constantly, then the position of the ankle holds the Achilles in a shortened position. And so over time, that's going to let your Achilles be in a position where it's used to being shorter as opposed to being stretched out. And that certainly can contribute.
Or does that just set you up for a greater likelihood of an Achilles injury?
I think it sets you up for a greater likelihood of injury because if it's shortened, then it's just not going to be as pliable at a longer length.
Okay. What about the impact of pounds per pressure of body weight? We talked a lot about this with Dr. Colvin with respect to osteoarthritis. So how is that impacted by the physics of how your weight is distributed when you're wearing high heels?
Right, and so if you think about what the high heel does to the foot, rather than distributing the weight over a wider surface area across the heel and the balls of your feet, you're looking at concentrating all of that pressure at the balls of your feet. And so that can result in issues with the nerves being compressed. It can cause problems with the parts of the bone on the bottom of the foot where it's making contact, and you can develop pain there as well.
So what is the solution?
I think like the solution...
We should have had Dr. Taryn Rose participating in this conversation.
I think... Yeah,
I know her. She's an orthopedic surgeon who got so fed up, she developed her own line of very attractive, but more comfortable and more practical footwear. I have to say, I've never owned a pair of her shoes.
I have tried her shoes. When I heard about her, I had to give it a try, and they definitely are worth the hype. I think as an orthopedic surgeon, she's foot and ankle trained. And she understands the forces that are going through your feet, and she also understands how many women want to wear stylish shoes, so she beautifully marries the two, and I'm personally a fan. Now, of course, not everybody can afford Taryn Rose shoes. They are not
very
expensive.
And
so
like Easy Spirit. Easy Spirit. I remember the first time I wore Easy Spirit shoes, which had to be at least 20 years ago, when they first came out, and they had an ad showing women basketball players playing basketball in these shoes. And I felt like I really could play basketball in those shoes. However, now I focus, now that I've achieved a certain status in my career, I really do wear sneakers at all times, unless I absolutely have to wear any other kind of shoes, and no heels at all.
Yeah.
And as you know, I do a lot of television, and one of my favorite little behind the scenes vignettes is there was one day, one of the women anchors on the Today Show, who will remain nameless, they sit behind a desk often. Sometimes they're on the couch with their legs crossed, but when they're anchoring, they can sit behind the desk. And she was wearing pink bunny slippers.
Definitely comfortable, doesn't cause bunions.
So tell us about how high heel injuries can affect other joints, such as the knee or even the shoulder.
Absolutely. Well, I think for the shoulder, if you have a bad spill, then you can definitely end up with shoulder injuries. But if you're not well aligned down at the foot and ankle, then it certainly can change the pressures that are being experienced through the knee and the hips. It can change your posture and result in low back problems as well. And so, like we were saying earlier, everything ends up being connected. You have this kinetic chain that is affected up top when you make a change down below. And so for that reason, I think that having good, comfortable, supportive shoes the majority of the time is going to be important. Now, I'll never tell somebody to never wear heels. I think that's a tough sell, but I think there's a strong argument for having that spare pair of shoes if you have a bit of walking before you have to throw on the high heels.
Yeah, I've even told, my daughter is a professional actress, and I have even told her, very specifically, do not wear heels when you're walking, outside. Wear your sneakers to your audition or to your party or to the event, and then change your shoes. I think that's a really practical solution. What other tips would you offer to women for other solutions if they're not going to go cold turkey?
Well, I think like you're saying, that's a great idea, is just to have a spare pair of shoes. And I have zero interest in this, but I do want to say that I discovered a great handbag by a local Portland designer called Toe to Heel, where she actually created a shoe pouch and she integrated that into all of her purses.
Wow, I love that.
Yeah, it's really cool. She used to be a manager at Nordstrom, and she would walk all over town to and from work. And she would always change her shoes. She didn't want to put her, nasty shoes that she walked through the city in into her handbag. And so she created a whole handbag line that has this removable, washable shoe pouch that attaches the inside. So it's pretty brilliant.
My Nike gym bag has a separate shoe pouch, but that's, again, for sneakers.
Yeah.
So I think we've really done a good job covering this whole thing. I think probably if there was one bottom line, it would be to tell people to pay attention to pain. We're going to talk about how pain is a signal, not just for this indication, but for just about anything in orthopedics.
Pain is a protective response. And so I always tell my patients, relative to not just shoe wear, but just about everything else, that that's your body's way of communicating with you that you should probably slow down or stop. And of course, there are different kinds of pain. When people are working out, there's going to be post-workout soreness. That's a little bit different than the kind of pain that you get from an overuse injury, for example. And so it's definitely something that we should all pay attention to.
And when we're talking about overuse injuries, specifically for our weekend warrior athlete types, I find myself saying on a very frequent basis about rice. You want to talk to people about what that is, what it means, and what they're supposed to do?
Rice is rest, ice, compression, and elevation. And so of those extremities that you can elevate, now of course it's hard to do with the shoulder and the hip, but like ankles, knees, hands, wrists, elbows. If you are injured or you feel like you're starting to get a little bit sore, then elevation certainly helps. Sometimes compression can help as well, and that's with an ACE wrap or other compressive sleeve. Ice can slow down a little bit of that inflammation post-injury, so that's the I part, and rest, of course, cannot be underemphasized.
I'm a big fan of rest.
Absolutely.
So just to switch gears on you a little bit, I know that you also have a great interest in mentoring younger women who are entering medicine and encouraging people from different backgrounds to enter medicine, and particularly orthopedic surgery. What advice are you giving to young women who say, oh, I'd like to be an orthopedic surgeon, but...
I think it's been really important to just let young women know that it is possible to still have a family. It is possible to have work-life balance, and not to let those things alone deter them. And it's not to say it's not a challenge, and I know with you being a mom and a physician, you also know very well that it's not easy, and it's oftentimes a juggling act, but it is still possible. I think that there are too many young women being turned away from surgical fields because they're being told lies about here's one. OR Barbie would never go for this. You'll never find a husband. First of all, he's got to find me, right? But things like that, or like, oh, you'll never be able to have kids, or you're not going to be a good mom, and all these things are just fallacies. You can have a career, and you can have these other things, and while we don't say you can have it all, there is a little bit of a give and take, and there's always a little bit of compromise. You can still be these things and be a surgeon.
So what I used to say is you can have it all, you can do it all, you can be it all, just not at the same time.
Yes, exactly.
That's the hard part, the not at the same time. Yeah. I will tell you that when I was, even before I went into college, I had the dream of being an orthopedic surgeon myself. And what dissuaded me from going into orthopedics was none of those things. But what dissuaded me was the idea that the surgeries I was scrubbing in on were mostly spinal, and they were very, very long. And I thought, how am I possibly not going to be able to go to the bathroom for 8 to 12 hours? So I think that is also a factor that women are factoring in. Obviously now, arthroscopy was not a thing when I was in medical school. It was just starting to be a thing. So I think now people are seeing it in a different light. But I think, given that this is the ladies' room, so how do you manage that bathroom issue when you're scrubbing in on a long surgery?
Well, personally, because I do sports and arthroscopy, my surgeries generally are not more than 3 hours. And so I could definitely hold it for 3 hours.
But in your training?
Yes, we had longer surgeries. And I have colleagues that do even longer surgeries, some of which, like if you're talking about plastic surgery with flaps in which they're transferring tissue and having to do a lot of microsurgery, some of these can be a whole day long, overnight even. And a lot of times if there are these marathon surgeries, people stop to go to the bathroom. Like you can't really fight just your basic human needs, even if you're a surgeon. And so people take bathroom breaks. You scrub out, you scrub back in. Anesthesia's there to keep the patient okay.
Yeah, so we got the anesthesiologist.
That's for sure.
So this has been a pleasure. Before I let you go, I have to ask you the question I ask everybody. Aside from this interview, what was your most unique, memorable, interesting, or remarkable experience that you ever had in a ladies' room?
Well, as an orthopedic surgeon, I would say the most memorable experience in the bathroom would have been going to a meeting and running into other women in the bathroom. That was exciting. And so, on orthopedic surgery Facebook groups, sometimes you'll see the female bathroom selfie, and it's so exciting because we didn't used to be able to take group selfies in the bathroom. It was a solo selfie.
It's probably the only medical meeting where you didn't have to worry about waiting on a long line.
There was no line. There's still no line, but we're working on it.
That's awesome. Anyway, thank you so much for joining us. Where can people find you in cyberspace? What's your Facebook?
So I'm on Facebook. If you just type in my name, Nancy Yen Shipley, MD, you can find me on Facebook. I'm very active on Instagram as well as Twitter. And my handle there on both of those places is _NancyMD. And I'm also at www.nancymd.com.
Thank you so much for joining us. We really appreciate it. And thanks to everybody who tuned in to listen to us in the ladies' room. Take care.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.